Hello and welcome to Fact Files as we continue to understand the facts behind the crisis that we're facing today in the Indian context, and also to understand what are the steps that are being taken to prepare ourselves for it, again, in the healthcare capacity context. I'm joined now by Dr. Girdhar Gyani, the Director General of the Association of Healthcare Providers. Dr. Gyani, thank you so much for joining us.
Thank you very much.
Okay. So first of all, could you tell us what the Association of Healthcare Providers does and what is the role that you're playing today?
You see, Association of Healthcare Providers India came into existence in December 2012, basically to take advocacy issues with the government and the regulatory agency on the issues, which are coming in the way of, providing universal health coverage. And our motto was well-being of the common man. So I think with that, we started functioning of this association. We also have one secondary role of building capacity into the Indian health system, by which we help our member hospital on the issues like affordability, patient safety. These are our main focus now. How do we run the hospital at the affordable cost as well as ensuring the patient safety? So with that, we have been functioning for all these years.
Right. And how many members do you have? How many are hospitals and what is the kinds of hospitals or other healthcare centers?
You see, we have a directory, printed directory of hospital with the bed size of 100 and above. And in that number is around 2,800. Remaining hospitals are our member through our chapters. So we have got 15 chapters, state chapters, what we call. And rough size of the total membership is around 10 to 11,000, in between 10 to 11,000.
Okay, and I'm going to come back to the hospital capacity in a moment, but you've also made some news because you were quoted saying that, we are going to be entering stage 3 of the coronavirus epidemic. So could you clarify what you said then and what context?
Yeah. You see, that interview was the day, when we got a couple of cases reported, which without any linkages with that they returned from the foreign country, or with they were having the direct contact with the people who returned from the foreign countries. So obviously there was a panic button that how these two patients have come and how they have come. So I mentioned to it that if this case number becomes large, then that is a sign that we will be entering into the stage 3. That is the community spread. But luckily, that number is still small, so we can't say that. But I think that headline quoted above us that we are in the stage 3.
Okay, so you're saying you're not in stage? Yeah.
No, actually I'm not. I tell you why. You see, even today, of course, number has gone little more today, more than 100 in last 24 hours. But still the increase is more of the arithmetic in nature. You see, the day actual community spread happens, you will see geometrical rise, exponential rise, and that will be the signal. But I still maintain one thing. All the countries, we have learned from them, we have to be prepared as if we are in stage 3. So that is a way of difference of putting it. But that was quoted, that we are actually in stage 3. There's nothing wrong in, I don't want to say it is a panic button, and I think government, if you see, has already taken note of it. In fact, yesterday I heard Chief Minister of Delhi on the television. He is saying that 100 patient comes per day in Delhi, I am prepared. Then he said, even 1,000 patient come, we are prepared. Now that indicates that even they are preparing themselves for that eventually, if at all it happens.
Right.
Now, the issue which you have to understand, you may be asking the question next maybe, this lockdown which we have done, we have done based on the research done in Italy, China, other countries. How it is helping us? One, of course, is we are trying to arrest the spread. Whatever it has happened. So we are arresting it. Number 2, during this time, government actually starts preparing. This 15 days is the time that government has to prepare, identify the number of beds, ICU bed, location, manpower, training, PPEs, all those things. So it is a very crucial point, which public, we may not be able to tell them that this time government has got a good time to prepare.
Okay, so another point that was again mentioned in some of the articles, that you're part of a task force on COVID-19 hospitals. Is that correct?
What is the task force? Let me explain, because they have not clarified what is the task force. Niti Aayog had a meeting with the all major industry group on 20th. Now, what is that meeting? They wanted that all these associations like HPI, Net Health, CII, FICCI, ASSOCHAM, they should come together and work on the specific issues and keep us informed. So based on that, we constituted 4 task force, and one of them was how do we prepare COVID hospital, and I am the convener of that task force. I prepared the report, I have shared with the media also, and in fact only today morning that report, my report, has been further finalized by the total group, and it is going to Niti Aayog.
Right. So you're saying this is a task force that you have set up under the Association of Healthcare Providers, as opposed to the
not combined, joint. Association of Healthcare Providers, Net Health, CII, FICCI, and ASSOCHAM, all 5 together.
And working with Niti Aayog, and for which you've submitted.
And submitting to them, yeah, because it initiation came from Niti Aayog.
Okay. So what are the key highlights or headlines of this report, Dr. Gyani?
Very few I will mention here. Number 1, we must do mapping of all the states in the country. In the sense, we have taken the report from the Wuhan that they suggested that 2.6 beds should be earmarked for 10,000 population. ICU bed, sorry. 2.6 ICU bed should be earmarked for 10,000 population. So that means in a city like Bangalore, minimum of 2,000 ICU beds should be required, out of which 50% should be again, ventilator beds. So that is similarly, let us say, coming to Mumbai, number will come around 2,500 ICU beds. In Delhi, I don't, God forsake it, nothing happens. Otherwise, we may need 3,000 ICU beds. That was one recommendation. Second recommendation was that we should not mix up the COVID and non-COVID patient. Again, we relied on the report from the Italy, where when they put the patient in the same hospital, 40% non-COVID patient got infected. So we are strongly suggesting, and today I took a review from my all state chapters just before this call, and some of the state government is asking, if let us say 25% bed, please keep for us. While some other states, they are saying, no, we will earmark 2 or 3 or 4 hospital private, complete, and convert them into COVID. So our recommendation is, first, take the government hospital. And we have suggested that government patient can be shifted to the private, which is the non-COVID, so that government hospitals are ready, available. Anything happens tomorrow, our hospitals will be empty, government hospitals. Second, ESI hospital, PSU hospitals, railway hospital, medical college hospitals, all private and government, and dental medical colleges. So I think that is the first line of action, should be this one. Only when you fall short, earmark some private hospital. And I must add here, I had a word with my MEX group yesterday evening, and they have already given one of the exclusive hospital in Noida to government, that this can be used as COVID hospital.
Right. So can we look at the numbers? So as per your calculation, how many beds, which is ICU beds, that are ready to take COVID patients available across the country, and do all COVID patients require ICU beds?
No, not all COVID. You see, this we have seen from the World Survey. That people who will have mild symptoms, they obviously will not require ICU. Particularly the age group which are below 60 or below 55 definitely may not require the ICU beds. ICU beds we will have to keep for the patient who are above 65. Secondly, we need ventilator if the people are asthmatic also. If they are already asthmatic and if they get the COVID infection, definitely they will have to be on the ventilators. So that is the way I think we have to see. And when I use the word mapping, the idea was that we know some of the places where the infection is more, like in Kerala and Maharashtra. Identify those areas, go beyond 2.6 which I mentioned, 2.6 per 10,000. No, you can keep even 3 for per 10,000 if you have to be in the readiness.
Right. So how does this, or rather, what does this add up to across the country in terms of what we have today and what is ideal in a worst case situation?
You see, this problem is that next 3, 4, or 5 days, I'm saying, we will really come to know that the people who are now in lockdown and who are going to show these symptoms, because symptoms will come after 5 on the 5th, 6th, 7th, 8th, and 9th day. Now, I think we are very closely approaching that period, and if that spread is showing in a limited number, we are saved. If it really goes beyond, then we will have to create a lot of temporary measures, the way China does or the way army does normally. But presently, let me tell you, we have got about 7 to 8 lakhs bed in government and equal number of beds in private. That means 16 lakhs beds are available in the country. As far as 8 lakhs of private sector is concerned, we have got 20% beds are normally ICU. Average, I'm saying. Somewhere will be 30%, somewhere will be 10%. Similarly, in the government sector, the ICU bed number will be less. They will have normally 10% of the ICU beds, except AIMS and PGI. So, if you take the total number, that has to be kept in readiness. And once we know the spread, if it is going to be more, that's why you see that panic situation has happened, because ventilators now we find maybe in the short supply.
Can I come back to that number? So you're saying there are about 200,000 ICU beds in India, roughly? Or is it less or more?
I say, yeah. By the calculation, if you can do it the way I mentioned to you, 20% of the 8 lakhs and 10% of the 8 lakhs. So that means...
Right, so that's 80,000 plus 160,000.
Like that.
That's more than 2 lakhs, about 2.2 lakhs.
Yes.
No, so 2.2 lakhs, and do we have equal number of ventilators at this point?
No, normally, we maintain 50%. Normally, the rule is that ICU beds, 50% should be equipped with the ventilators.
Right.
So if the normal epidemic happens, we are able to control. If it goes beyond control, even country like USA has not been able to...
Sure. So, and this 2.2 lakh beds, or roughly that we have ICU beds, what is the dispersion across the country? I mean, is it weighted towards parts of the country?
That issue we have always been talking. For example, if you take Telangana, we had around 125 hospitals in Telangana with a bed size of 100 and above. And out of which 105 were in Hyderabad only. So that distribution is a problem, that you will find Hyderabad flooded. Similarly, in Tamil Nadu, 50% of such hospitals are in Coimbatore and Chennai. So this problem exists in India. There are other reasons for it, why it is existing. So if this kind of things happen, the transportation is going to be the key. How do we transport the patient from one location to, let us say, Hyderabad, one location to, let us say, Coimbatore? So that also plan is being made in the part of the preparedness.
Right. Okay. So last couple of questions. One is, now that as a task force member, you've studied Wuhan, you've studied Italy. What are the 2 or 3 things that we should be doing or not doing today from a public health point of view that and that we should all know about as well?
You see, one is timely action. And we only believe that we have taken reasonably, I will say, timely action of putting the lockdown, number one. We have started preparing ourselves. We have started contacting all these private hospitals. This is what we have done. Third thing is very important is that we have stopped normal OPDs. We have stopped selective surgery. If you visit any private hospital today, you will find a sorry state. Sorry state in the sense that they are running only with a 30% patient load.
Mm-hmm.
So that actually is giving me another worry, that if this continues for 2 months, our financial sustainability of the hospital will be in problem. But hopefully, I think government will take care of that. So what I'm saying, we are that way prepared, that because patient load is only 30%, if whole hospital is to be given for the COVID, it can easily be done because we don't have to shift many of the patients. So that preparedness is going on. Now, the testing is one of the issues which everybody is talking. And we have today 118 government labs, 39 private labs, which has been authorized. We have capacity of 15,000 tests, which can be done in one day. But we are not using, XY everywhere, because still we are not adequate enough test kits are available. Okay, that number is not being shared with us,
Right.
or nobody knows it. But I think the way America also is not doing test on everyone, they are also doing on selective thing. But as and when I think the supply of kits, which is increasing now, we will do more testing. So this time of lockdown, hopefully we will be doing more testing to establish in next 1 week whether we have actually gone into community spread or no, we are still in control.
Right. Okay. Thank you very much, Dr. Gyani. So I'll take away 2 quick points from what you've said. One is that we have about 220,000 ICU beds, and currently most hospitals in this country are working at about 30% capacity in anticipation of load coming from COVID. So that's good news. And perhaps we are better off or better positioned at this point than many other countries. Many other countries have been. On the other hand, of course, most of the hospital capacity is in medium to large cities or metros.
That's right.
So that's an area of concern. And we, of course, hope that there will not be any community spread and the way that we've seen it in other countries. Have I captured the key points, Dr. Gyani?
Yeah, very important. Only thing you can give the last message to your viewer that, people, some of them are still not taking it seriously, this lockdown. I think they must understand what it means,
Right.
Very important to remain isolated.
Yes. Right. On that note, thank you very much, Dr. Gyani. And we do, of course, hope that we are all safe and stay safe and recover soon from this pandemic. Thank you very much for joining us.
Thank you very much. Thank you.